Hello, and thank you for attending and listening to this recorded presentation. My name is Dr. Paige Miller. I am a professor of sociology at the University of Wisconsin River Falls. My co-author on this study, Dr. Wesley Shrum, is also a sociology professor at Louisiana State University. The presentation that you are listening to is titled Expert Distrust and Precautions Taken, What Might Be Learned from the COVID-19 Pandemic. This study is actually the data that what I will be presenting to you today is data from a national survey of Americans. It is actually, this study is part of a 9-country NSF funded project that takes place in the countries listed here. This survey builds on experience that that Dr. Wesley Shrum and myself have researching other pandemics related to Ebola and Zika primarily. So the purpose of the study is really fivefold. So in part, the goal of this research and part of what I'll be presenting to you today is to understand better what respondents were told to do and how they understood what they were told to do by experts during the course of this pandemic. So, one thing that we know is formal and informal sources of information for making decisions are weighed differently across groups and contexts, and they vary based on trust in public institutions as well as the media. So part of this goal, this study is designed to understand better what respondents were told to do to prevent contraction, and then also by whom. But then linked to that, we also hope to understand better how respondents assess the risks surrounding COVID-19, as well as how do they assess the different recommendations in terms of how effective they are in preventing spread. As many of us know, below a certain threshold of cooperation on the part of the community, recommendations are going to be ineffective for ensuring public safety. The third goal of this project in this study is to understand better what precautions were actually taken and how frequently respondents actually engaged in those precautions. The fourth goal of this project is to better understand how burdensome respondents saw certain recommendations. This really builds on some of the research that has been done on Ebola and Zika in Africa and South America by our project. We found that the more burdensome the actions or prohibitions are, and the longer that they last, the less willing people are to continue doing them or to do them again in the future. Finally, the last item that we hope to be able to pursue with this research is this question of what might be the short and long-term consequences of official and personal responses to the disease. Experts have been warning of the potential mental and emotional fallout associated with social distancing and the economic uncertainty that has emerged from state shutdowns. And these can range from manifest consequences of depression and anxiety over health and financial well-being, and some also suggest potentially even the more latent consequences of social unrest. So those are the 5 kinds of overarching goals of this project. What I will be presenting to you today is just the part of the project that's based solely in the United States. I won't be presenting research from Brazil or Ghana or India or these other places. This project is an online survey that was distributed using the software Alchemer in the late summer of 2021. So just this last August. The survey consists of approximately 400 items and took approximately 30 minutes to complete. Those items were all multiple choice, standard 4-point, 5-point Likert scale items related to the 5 questions that I just covered. The survey targeted, it was a national survey of men and women ages 18 to 79. Invitations that were sent to people through the Alchemer system were balanced by census representative splits for age, gender, region, and as well as ethnicity. So trying as much as possible to get a representative sample while this is not a random sample. The total sample size was ultimately 10,022. The information that I will be specifically presenting today relates to sources of information. By this, I assess a number of different different media sources different sources that people might use to gather information related to COVID. So these sources range from media sources to local and national health sources to national and local government, as well as family and friends. So I asked, I'll be presenting data related to which sources were used, which sources were seen as most reliable, and which sources were sort of assessed as reacting appropriately or not to the pandemic. In addition to that, I present data on the way in which, on the different precautions that respondents followed, their attitudes towards those precautions, including a section specifically related to vaccines. Most of the questions have been recoded. They, as I said previously, they in the original form, they were 4 or 5 point Likert scale items ranging from strongly agree to strongly disagree, for instance, or very reliable to not reliable at all. They were recoded into 2 point items where strongly agree and agree were merged into one category, strongly disagree and disagree into another category, for example. So that is what I'll be presenting to you. So the sample characteristics, the majority of the sample identify as white women over the age of 35, with 46% identifying as 55 and over, and 30% between the ages of 35 and 45. So those were the bulk of the respondents between those ages. Half the sample had a bachelor's degree or higher. Half were employed at the time of the survey. The bulk of the sample identified as moderate politically, followed by right-leaning, and then lastly, left-leaning. The majority of the sample, over 50%, assessed their income as being in the middle third relative to others in their city or town, followed by 33% identifying as being the bottom third and 14% in the top third. The first table that I'll be presenting to you relates to vaccination status, and then as well as attitudes towards vaccines, COVID vaccines. So the thing to really point out here within this table is that the majority of the sample, they have been vaccinated. That's the item 1. So 73% of the sample have already been vaccinated. In addition to that, another third of the sample intends to get vaccinated. That's that item 2, 35.3%. And then of those who have not been vaccinated, approximately 16% see themselves have already had COVID, and so potentially see themselves as having a degree of natural immunity. That's that item 9 down there, that's 16.5%. Beyond those who have been vaccinated, this data from items 3 through 8 really shows that the majority of our sample, in addition to actually just being vaccinated, the majority of the sample also do get vaccines as being the main solution to bring the pandemic to a close. 71.2% say this. Having said that, while the majority do see vaccines as being the solution to the pandemic, it's also clear that many of the respondents do have some concerns related to the vaccine, including the potential for side effects, and even determining which vaccines are right for them. So in spite of the fact that there's a high degree of compliance with getting the vaccine, and even support of the vaccine, that doesn't go hand in hand with a total lack of concern. In table 2, I look at some of the precautions taken. For this, for the precautions, the survey actually asked 40 separate precaution questions. And because of obviously the time constraints here for this presentation, as well as our desire to be cognizant of the time of our respondents, we ended up using a split sample with the precautions, so that 20 of the precaution questions were asked of half of our sample and 20 were asked of the other half of the sample. Within that today, I am just going to be asking, I'm going to be presenting data related to the precautions that you might argue were among the most contentious. So I'll look at precautions related to face masks and social distancing primarily. We also asked questions about the frequency in which people engaged in hand washing, sanitizing their hands, sneezing into their elbow, even praying and meditating. But these were the compliance for those things were really quite high. And so I'll only be presenting on the results related to the more contentious precautions. Within this, what we see is that for the bulk of the precautions, just like with the vaccines, we see that the majority of this sample adhere to the precautions. I've ordered them in from in descending order of adherence, so that we see, most people were wearing face masks whenever they entered a store or restaurant at 91%, that first item there. And really, for most of the face mask questions, we see that respondents were adhering to them and did wear them most of the time. This data reflects the percent who say that they sometimes or frequently wore the face mask, as opposed to infrequently or never. We do start to see that that adherence begins to go down a bit. But even still, when we get down here to the seventh item related to social distancing, we're still at about 80%. But really, it is the social distancing measures that seems to have the least amount of adherence to them. And this becomes especially pronounced when we look at number 9, avoiding close interactions with people that you live with, where only 42.4% adhere to that for very obvious reasons. In tables 3, 4, and 5, I look at the frequency of using different sources for information on COVID. These sources are primarily local and national health experts, local and national government, media sources, as well as work, school, family, and friends. So I look at the frequency of using those sources in table 3, respondents' assessment of how reliable those sources are in table 4, and then respondents' assessment of how well these sources responded to the pandemic in terms of, did they overreact, underreact, or react just about right. So with this first one, I've highlighted in red the sources that were used most frequently. So local health experts and national health experts were used most frequently. Those sources used least frequently were school and work, as well as the media sources, both social media and traditional print and broadcast journalists. In this next table, I look at how respondents rated these sources in terms of their reliability. Again, those sources rated as most reliable are highlighted in red. So local and national health experts, again, emerge as the more reliable sources. And interestingly enough, we also see that family and friends also come in as emerging as fairly reliable sources in people's views. Mimicking the table before, we see again that work and school, as well as the media sources, are not rated that favorably in terms of how reliable they are. And then finally, this last table looks at people's assessment of how well these different sources did in terms of reacting in their reporting or in their conversations about the pandemic. And respondents could rate them as not taking it seriously enough, reacting about right, or actually overreacting. And so in red, I highlight the sources that are rated as being most sort of as the sources that were most likely to be rated as reacting about right. And interestingly, we see that family and friends are rated the highest in terms of reacting about right. The sources in purple report information for the sources that are most likely to be rated as overreacting and not taking it seriously enough. So social media is pretty much largely sort of condemned as not doing the greatest job, equally likely to be rated as overreacting and not taking it seriously enough. And then interestingly, we also see that the most likely to be rated as overreacting is print and broadcast, traditional print and broadcast media. So where do we go from here? I would say that overall, what these results show us is that Americans exhibit a pretty high level of compliance with precautionary measures. Among my apologies. Among the specific precautions included in the study, most were known, and most were also followed by a majority of respondents, and not just the ones I presented here, but also the ones that I did not present. According to these results, people seem to find it easier to adopt new behaviors, such as wearing face masks, than they do to change existing behaviors, such as avoiding regular places or activities. The recommendation to avoid close contact with housemates, that was generally the least followed. And this really stands in sharp contrast to another major finding from this study that I don't report here, which is that most of the people in our sample who admitted to being sick or diagnosed with COVID-19 they were pretty sure infected by someone that they lived with. So simply put, Americans, they may not realize the danger of close interactions with housemates, or they just may not be able to actually limit their interactions in that way. To get information about COVID-19, it looks like Americans are relying on national health experts like the CDC, as well as local health experts, as well as family members. There's really no evidence that disinformation on social media has been a major issue. Many Americans do, however, seem to find it difficult to believe the information they get from authorities. And this is not information that I presented here, but we also ask questions about their concerns. And one of their greatest concerns is with false or inaccurate information and the lack of agreement among experts. And I would just say that among study respondents, most have already been vaccinated. And so I think what these findings really emphasize is the importance of consistent and measured messaging from officials, the need to address people's concern in a manner that is both clear, empathetic, and avoids demonizing or further polarization, particularly if you want to increase compliance with this pandemic or with others in the future. Thank you.